I'm so excited to be sitting today with our president and CEO, Ben Marcantonio. So thanks, Ben, for being here. And today, the actual day today, is Hospice of the Chesapeake's 40th anniversary. So Ben and I are going to talk a little bit about the journey of Hospice of the Chesapeake and sort of where it's been, where it's going, and that kind of fun stuff. So I'm really happy that you're sitting here with me.
I'm very happy to be here.
And so let's start with, what's the biggest change? What has changed the most for Hospice of the Chesapeake from 40 years ago?
Okay. I'm going to answer the question.
Okay.
Can I start with what hasn't changed?
Yes,
And what
please.
hasn't changed is our mission.
Okay.
I mean, always there to take care of people who need us at a point in their life that is one of the most vulnerable times, in that journey. So, fulfilling that mission and carrying that out day after day, whether it's been with 4 people when we first started to 480, 90 people now, that has been the same. And that's our legacy and what we're so proud of.
That's awesome.
But your question is really important because things have changed, of course, dramatically from 40 years ago. And I think, there are 2 elements, I think, to the change that are most, I think, profound.
Okay.
And one is that the needs of the community have changed over time. And from that time when we were serving 4 people, the predominant need was around cancer and AIDS, people living with those illnesses, where the clarity of that with knowing that we have that the person has that illness and
Right.
what that brings
That
in a matter
diagnosis.
of months or years, that diagnosis brings, and the journey that will be, that we were the experts in understanding that and therefore accompanying them on that journey.
Okay.
And that has continued, of course, but then other needs came up and we identified, well, gosh, people aren't dying only from and living with serious illness related to cancer or HIV and AIDS, but also heart disease and dementia, and that journey and that end of life need is as important but manifests in a different way. So we had to adapt what we do and how we do it. So and similarly, like how we respond to and support grief needs related to what we learned in working with hospice families and what they needed after the loss of their loved one. We realized that we needed to be a resource to those who lost people in other ways, because again, we had become experts in that and the community looked to us for that. So we evolved and changed in that way as well. And dealing then not only with adults but with children, we say there's a very important need to meet there. So that responsiveness to need,
Right.
and the changing needs of the community, that's been what we've done as an organization and as a mission-focused organization to support, and what our board has committed to for us.
So while the mission has stayed the same, while
Right.
the end result has stayed sort of the same, sort of other things have really
Absolutely.
changed.
Right.
I mean, you mentioned, you're talking about diagnoses and cancer and AIDS. I mean, you think about 40 years ago and where we are now, that is such a huge
Very
difference
different.
if somebody comes out with that diagnosis,
Right.
what their journey's gonna be, right? It's so I get that we really have had to sort of move forward with the times.
Yeah.
So has hospice care itself changed in that time period, or?
Well, yeah, that's kind of the other dimension of change that is very poignant, and that is that the environment of healthcare has changed dramatically.
Absolutely.
And with that, again, we have to be responsive, not reactive to, but everything from moving from being a volunteer-based and a philanthropically supported only kind of organization to where we did start to get reimbursed through the Medicare benefit, which was in the early mid-'80s.
Okay.
So that just changed a lot, not just for us, but how hospices overall began to function, because you had to have certain things in place. You were receiving payment for those services, so you were making decisions about what and how you would use those resources, on behalf of the people being served and
Right.
the community. And you wanted to continue that volunteer because that was part of the requirement, but also because of the roots of that and how important that was to the hospice philosophy. So responding to that, and then with that, all the regulatory elements that have come, and we've really experienced that in a big way in the last 15 years.
So because you're providing a healthcare service.
Exactly. So you have a whole different level of responsibility for what that care is and how it's delivered, and in order to be worthy of that compensation, to continue to do that good.
Right.
Yeah.
Wow, that's a lot.
It is a lot.
That's a lot of different aspects.
Mm-hmm.
Wow. So we talk a lot, right? We started with speaking too about the journey, and our mission here at Hospice of the Chesapeake is caring for life throughout the journey with illness and loss, and we really say that all the time, and it is who we are and what we do. We've talked for a couple minutes here. It's fascinating to me, to look at the history of the organization, but journey-wise, where are we right now on the journey? Where would you say Hospice of the Chesapeake is at this moment today in 2019?
Yeah. Well, I think we're an organization. We're a group of committed people who have, I think, really honored the legacy of the people who sat around that table in Severna Park 40 years ago and said, we want to do something different for people in the healthcare, have them have a different healthcare experience when they are experiencing serious illness. So we are at a place where I think we continue to honor that legacy, with real sincerity and with success, I think. Mm-hmm. And the other is that we have, because we've stayed attuned to the needs of the community and responsive to that, we are providing a breadth of services that we might not have otherwise done, and that some organizations don't do. Some examples around that. I mentioned pediatric services. Yeah. I mentioned, more expansive services in our Chesapeake Life Center that many other hospices don't do. So we're contributing back to the community in those ways. Another really important way that we've committed to care is to care for people not only when they need end-of-life care with hospice in the last 6 months or so of their life, but before that with palliative care or supportive care. That is whole person care, the same hospice philosophy, but provided to people earlier at the point of need.
Which I think people are just starting to sort of understand the difference and the benefit that palliative care can provide, and the benefit that hospice care can provide. Have you currently in this, it's interesting, we're talking about the whole healthcare aspect of things. I know I've talked to other folks that when you mention the word hospice, that have you seen in the journey a difference in sort of how the reaction for that word, and the word palliative too? I feel like palliative can sometimes, both of those words, there's a lot of misunderstanding
very much so.
But I'm curious about, because you're out there, you have a lot of different input.
Yeah, so we've been using the word hospice for 40 and plus years, because the modern hospice movement started in England with Dr. Cicely Saunders, and that's what it was called, and it sort of gravitated over to the United States and manifested in a way. In other parts of the world, palliative care was sort of the precursor more than hospice, like in Canada, other parts of Europe. Okay. Palliative care was the term used more predominantly than hospice. Okay. So in the 18 years that I've been doing this, it's each new person you talk with, each new group you talk with, there are different degrees to which the word hospice is either accepted or not, understood or not. And our constant work and mission is to help people understand, if not the word itself, at least what that is, what difference it makes in people's lives. And that's what's really important, regardless of what we call it. Right. That, at that time, and when one's on that journey, you need more than simply medical, and I don't mean to minimize that at all, but more than just medical intervention and care. You need spiritual support to respond to those existential questions and current concerns, the emotional support that's needed through social workers and counselor support, and of course then the medical expertise around keeping people comfortable physically. That's what it is, whatever we call it, right. Hospice or palliative care or supportive care or whatever you want. Right. What's important is getting that across and where that fits in the healthcare continuum. And that's where I think most importantly we are today. Yes. Is making sure people understand where we fit in that, because it's still today, and actually almost getting, I think, I don't know, worse is the right word, but more evident that people are waiting too long. The providers, other medical providers, physicians, nurses, discharge planners are waiting too long to refer, and people are still thinking that hospice or palliative care or this kind of care, again, whatever, is only for the last days or weeks of life. And
Right.
there's so much more that can be done to support people, and we hear it all the time.
Right. Such a good conversation. I just wanted to touch base and say thanks again to Ben Marcantonio. He's sitting here with me today on Hospice of the Chesapeake's 40th anniversary. We're talking about the journey of the organization, sort of where we started from, where we are today, and then we'll move forward a little bit and talk about sort of future thoughts. But I just wanted to say, if anyone has any questions or comments, feel free to join our conversation. We welcome them. I think that it's you started talking a little bit about, we've talked about the diagnoses and how that's sort of changed, and people sort of waiting until too long and not sort of understanding the benefits of hospice, how they can help sooner rather than later. I wonder, is it more of a challenge to share that information to the medical community or to the families? Do you see a difference in sharing that message?
I think both are equally important.
Okay.
They have to be delivered in different ways, I think, and made available in different ways. I think the professional groups that we have to get through to most significant, or most effectively hear it from other professionals, doctor to doctor, oftentimes. So where our medical leadership with Dr. Bush as our CMO and the whole team that he's developed, anytime our doctors and our nurse practitioners can be out and interfacing with other providers, helps that all the more, because they can bring the medical evidence-based data,
Right,
that other providers respond to and say, oh, I get how it makes the difference, or why the way I've been referring is not really helping people, and I don't lose anything by referring to someone sooner because I stay a partner in this.
And I'm sure that's with palliative as well as
exactly.
with hospice care.
Absolutely. And then for the community, like you said, just family members, the community at large, helping people understand it through education,
Yes.
And caregiver support messaging, because we know what it can be for people to be providing care as a family member to another family member, and not knowing what the resources are out there, and that this kind of care is a very significant one that can make a difference in their lives.
Yeah, absolutely.
So we have a question from Deborah McLaughlin. Ben, what changes have occurred over the years in the types of end-of-life illnesses and conditions Hospice of the Chesapeake staff and volunteers see and have become skilled with, helping patients and families navigate?
Okay. Yeah, thank you for the question, Deb. I think, as I mentioned before, as we've done more than work predominantly with cancer patients or HIV and AIDS, which was through the 80s and even early 90s, but then as we began to see more different types of cancer, and then people even with cancer diagnoses who are in remission and recovering and living in a different way with it, and then accumulating other illnesses along with that, our staff have really stepped up in terms of learning what the implications of that are for our patients and families. So when they go in to assess the needs of a patient, they're not just looking at one thing typically, and they've developed a skill set. And one type of dementia is different than another type of dementia, and it manifests, and the journey is different. And so our staff, with our medical leadership, again with that evidence-based sort of knowledge and sharing that skill with our interdisciplinary teams, them learning it together and amongst themselves and sharing that with each other, saying, this kind of patient, when I go into this home, I'm thinking this way, and I'm looking for these things, and I'm capturing this, and I'm documenting it in this way so that my team members understand, and we can create a plan of care that meets those unique needs. And then when I go into this home, this one might be Alzheimer's, this might be vascular dementia. It's similar, but it's different. And certainly different than that person who has melanoma and is in the last stages of that, or stage 4 cancer or some other specific cancer diagnosis.
And I think you're right. I think just from the progress that we've seen in the medical field, that people are living longer, then they start to have additional complicated
Exactly.
issues. So that just kind of makes it even more of a challenge. And again, where I feel like it seems like palliative care and getting that support, sooner rather than later, especially with those serious, complicated conditions, could really benefit.
Right.
Yeah. We have
I
another.
have a comment from Erica Bathgate. She said, hospice helped our family tremendously. Heart.
Oh, awesome.
Thank you. Glad we could be there for you and your family.
Absolutely. So, talking about current conditions and sort of where we are in this journey now, I'd love to hear from you your thoughts on sort of hospice of the Chesapeake specifically, in the next 40 years. Where do you see this journey taking us?
Yeah, I think it's an exciting one. I think there are lots of opportunities. I'm sure there'll be challenges, just like the pioneers of our organization and of our field.
Right.
Face their unique challenges. After 40 years of being a part of the healthcare system, now we face a new set of challenges. So we have to pioneer and probably more appropriately innovate.
Yes.
In ways that will carry us in. And one of the key I think aspects of that we have to be very mindful of and work very hard at is really defining where we are in that continuum, what we bring to the healthcare system that makes a difference that nobody else really brings. And that is that kind of whole person care. Again, having done it in the modern hospice movement for over 40 years, we bring an expertise that doesn't show up elsewhere in the healthcare system.
Right.
There are other strengths, skill sets that we can't live without in the health, emergency departments, critical care units, long-term care, services, preventive and wellness service. All those are so critically important. Our niche is finding and being there for people, delivering whole person care, and never forgetting that we're not treating any one aspect of the person, but every part of it at a unique time in their lives when they're living with, as you mentioned earlier, serious, complex illnesses,
Right.
whether it's at their last 6 months of life or before that, because we bring that to to that serious illness experience of the patient and the family.
Right.
And that's what we have to do in the next 10, 20, and 40 years, is to really enrich the healthcare continuum, have it be where people get the right care at the right time through the right kind of service over and over and over again, and just continually making sure that happens for each person's journey.
Yeah, and I think part of that what you've said is that we're trying to educate and inform people about what their options are, and that they have choices that they're able to make.
Yeah, and sometimes it's hard for the healthcare system overall to really get where we fit.
Yeah.
I think we know where we fit, but
Right.
it's that, again, like that messaging, that communication, and that voice of getting people to understand and then utilize us and to have us really be in our place appropriately.
So if someone wants to help us, help Hospice of the Chesapeake, are there anything, I know we were started with volunteers.
Right. Yeah.
I'm guessing that's a great.
Absolutely.
Okay.
Yeah, volunteers are critically important to our organization and to our mission, and volunteerism can be done in so many ways here, through at the bedside with patients and families for people who are comfortable and feel equipped to do that, and we give a lot of support for that, or administrative kind of support roles, or sometimes programs need additional support, or in the community when we do community, so many different opportunities for volunteers. And of course staff. I mean, if there are professionals out there and thinking about what kind of work do I want to do as a nurse, or as a social worker, or as a physician, or or as an administrative professional, consider and look and see what do we have open at any given time. And then of course our donors are incredibly important to us, and our partners. So all those ways are the healthcare provider partners. So all those are ways that we can receive support from people.
Awesome. I think that's about all the time we have for today. I really appreciate you being here, Ben.
Pleasure.
Thank you so much, and thanks you guys for watching.